Hi, my name's Gepina, and I'm here today with Megan, and we are going to share today about her journey. She's doing an immersion surgery recovery journey, and we're going to just have a conversation about how all the techniques and modalities have assisted and treated her in the phases of recovery. Megan, thank you for coming today. You know, the purpose of these conversations is, just to kind of focus on hearing from you what your experience is. Coming here, you found us a little bit later, within 4 or 5 weeks after surgery, plus minus, how you found us and how this transformed, how the healing phases were transformative for you.
It's been amazing. Like you said, I came to you a little later in the journey than you probably see some other post-surgery patients, but so I was definitely in need of your services and maybe didn't even realize how badly I was in need. And it's been, I don't want to oversell and use buzzwords, but transformative is an understatement. I mean, it's definitely been a big benefit for me physically, mentally, and you've really helped out more than I ever anticipated that you could.
Thank you. And you also came in with, I think you came in and you trusted the process, which I think is a really big deal.
Yeah.
When you came in for your first visit, which we always do a first visit for a client, I found that we want to get to know you. It's not just the surgery you've had, but I want to look at your whole life story. Like, why did you even start to get the surgery, so that we can tie into kind of fill in all the dots and make you feel whole again in your mind and your body, because that's huge to wake up and have a complete transformation. So even though you're excited, there's a lot of, catching up to do.
Right. Absolutely. Yeah, there were some physical delays. And then there's the mental side of things that you don't really even anticipate prior to surgery. And, you can try to anticipate, but things are worse before they're better. They were certainly, not where I thought they would be before I saw you. And every time that I saw you in the next few days, as my body was continuing to adjust, it was progressing positively, which was fantastic to experience.
But we underestimate really what a full body surgery is. And if you're okay to share, I think a couple things, because I'm really seeing another woman watching this who's either thinking about surgery, doesn't know if they want to invest in the lymphatic treatments and immersion programs that we have. Kind of what was your first inkling of kind of the beginning of your journey, which started way before we came in, which was like looking for the surgeon, whether it was online or a friend, and why you chose the surgeon you chose. These are just questions I know on my table every day.
Yep. And
then what kind of surgery, and then the recovery, but just kind of that beginning part of where your journey started.
Yeah, great questions. So I had been pondering having a breast augmentation for a while, and thought, I just put it off for a long time because I didn't think I really needed it. And I probably didn't when I initially thought about it. And over the years, my body changed a little, and it wasn't bad, but it was not what I wanted it to be. So I thought I'm going to at least have a conversation with the surgeon and explore what this might look like, because I didn't really know. I was just kind of speculating. And so I did that, had a few conversations with a few surgeons just to get some options, and met Dr. Eric Aguian from Opera Plastic Surgery in Portland. And I loved him. I loved the staff at his office. I mean, everything about it, it just felt right to me. When I left my consultation, I called my husband and I said, unless I go somewhere else and have an even better experience, I don't know why I wouldn't choose to see him, because he was just fantastic and it felt right. And he answered all of my questions and concerns. And so that's a little bit of background of how I got to that point. I knew that the recovery process was long and not very fun, but I don't know that I realized how much additional work my body would need. I thought that, it would just kind of heal itself, and it would take time, and sure, there would be some things that I would need to do along the way, but I didn't really know what that entailed. And as post-surgery, I realized, if I'm going to do this, I need to do it the right way. And any recommendation that he has, I need to listen because he's the doctor. He does this every day. And this is the first time I've ever done this. So I, just to take a step back, I think you asked, what kind of surgery I had. I had a breast lift, an augmentation, and a tummy tuck. So it was pretty intense. It wasn't, for me, it wasn't a easy surgery, but you have really helped with the recovery. You sped things along faster than I thought, faster than I thought I would see the results that I've seen from you. And that was through coming in consistently and listening to your recommendations of, hey, I'm going to need to see you twice a week for the first few weeks. And then we're going to see you once a week. And I want you doing these, stretches at home and really just listening and knowing that your expertise is here to help me and trying to implement everything that I could.
You've done all the doctor's orders, which is what I always tell patients. It's always like, what does your doctor say? Because every doctor has a different healing process. They have different garments they want to use. And so that is like bridging the gap between us and Dr. Eric, which we reach out to all the doctors if we get a referral. And it just made me really excited. He's one of the doctors who reached back out, and we've been working on a relationship with him for quite a few years. We started a clinic with him, and then, now we do a lot of referring back and forth because he's in Portland and I'm in Vancouver. So we're going to always have more. But with what you were saying with Dr. Eric, and his process of healing and recovery, it's so difficult to explain to clients exactly what they're going to go through. You also don't want to scare a client in what they're going to recover. You don't want to actually over-educate because we know as professionals, as a surgeon and as a lymph drainage therapist, I know how good you're going to feel at the end of your recovery doing the drainage work. And we get to know the surgeons, kind of their style. So we know when we're seeing Dr. Eric's patient, we know, okay, I know if they don't see us within a day or a week, I know how they'll arrive with like the drains and all the things that are happening. So within a week, we can treat a patient, or like for you, you found us later. So no more drains, no more like all the sort of the risk phase of infection is over. So you can dive in and go a little deeper, faster. But the stages of recovery in the first phase, you were still in the first phase at 5 weeks, which should have been over, which was swelling and bloating and discomfort and pain. Also not seeing any results yet. And then we had our first session and we did photos right away because your body hasn't, some people just heal really well. Most people do because you're doing all the right things that the doctor's asking you to do. Now we're as a lymphatic massage therapist post-surgery, we're seeing you all the time. And then you see your doctor for the follow-up. So that kind of bridge between nothing happening in 4 weeks and then you had one session, which is, it's a very specific technique for surgery. It's not just standard drainage for anything. What was that first initial consultation experience? Because that's always the hard one to click on, because we are more expensive, but the training that has to go into anyone even starting working here with the staff, which we'll talk about that in a minute, that first visit, because that's a big one to click on book. Yes.
Yeah, it was, there was a lot going on. I had to catch you up to speed on here's where I'm at and why I haven't, thought that I could get this done somewhere else and I wasn't seeing the results. And so I got to give you a little bit of a background. And then once, you started working on me, we did a lot. I think we were wrapped.
Yeah, we did the sweat therapy for just, relaxation. Yeah, getting the stress, the relaxation, and then a little bit of warmth to warm up the tissue.
Yep. And so you introduced me to a few different techniques, and I tried to I did have an open mind coming in because I knew that who am I to say like, no, I don't want that today. So just, do whatever you need to do. And, I think I was here for an hour, just over, I'm not really sure. And by the end of the session, like you said, we took the photos and you showed me and had me feel this. And it was unbelievable. Once again, I don't want to just use buzzwords, but it truly was unbelievable. And you showed me the pictures and I'm looking at my own stomach and I'm like, how was this an hour ago? I felt significantly different, not in a good way. You know, I felt lighter, and I hadn't even stood up yet, right? Like it was already like, wow, this is impactful. So that was great. And I would say every session since then has its own flavor depending on what you're seeing and feeling within my body. And I love that it's, you have a program, but it is custom to where I'm at that day, and you meet me there and proceed accordingly. Like, you know, whatever you're feeling and I'm feeling, we talk about it, and it's wonderful.
Yeah, it's exciting. Also, like I think it was like a third or fourth session, we had checked in on your legs. And so even though you didn't have surgery in your legs, we were talking about much more health history stuff, you know, with swelling, because it's connected. And so then we started treating your legs with some of the swelling in there. And has that improved over time? So treating the whole body in that way. Once we got some of the surgery stuff under control, we could actually look at other parts of the body and then go back to the surgery area.
Yeah, absolutely. And it's almost like addictive, where I'm like, what do we treat all of it today? What are we doing? I want everything drained as much as possible, because it feels so good. And I felt, you know, as you said, I didn't have surgery on my legs, and what could my legs have to do with this? And they did.
I'll actually explain a little bit of that and get into a little clinical geek stuff right now. Abdominal capacity, right? Like the central lymphatic, this lymphatic system runs through from here all the way down to the groin, you know, base of the groin, right? So when you have surgery and you've lifted the abdominal wall and you've pulled everything together, there's different places that we have affected the geography of the lymphatic system, which starts in the skin, goes down to the muscles, bone, the interstitial fluid, which is the skin down to the bone. So when you come in, you have a lot of volume. In other words, you've had surgery, you fill up with lymph, which is blood, and all these things in the interstitial spaces. But because we've done surgery, incision, cuts, those vessels they have been sort of injured, right? You can't avoid it between lipo and all the different things. So that's why in the beginning, it's critical to get manual drainage, because your body is not where it can move itself. For one, your body moves through muscular contraction. You're not exercising. Sure. So that's one thing that's that's why walking is really good. Safe walking, I always recommend for a tummy tuck. I'm like, get yourself a walker. Like, we need a lot of support stuff to start with. We've got incisions we don't want to move. We have bandages that we don't want to move. So in that phase of recovery, the lower abdominal area, even though the incision is above the legs, all of the pathways from the navel down to the feet affect the lymphatic flow. So we don't want to do a lot of work on an incision in the beginning phases. We want to first open up the drains in the inguinal, and then move on up. And as those heal and the scar tissue heals, then we can start to go to the second phase, which is the remodel phase, which was exciting. Where like now we're actually working on the scar tissue because it's fully healed, no more stitches. And then connecting the upper and lower body so that it looks and feels the same. So you don't feel like I had surgery here and now I have my legs. So that's like the remodel phase. And then now you're in the final phase, which you could do like the graduation phase, or I call it the postural. It's the therapy phase where you start to learn how to walk in your body. You're starting to come to the movement classes because now you've been cleared to exercise, which we don't start that until you're cleared to exercise from your doctor. So that's the third phase, which if you're thinking weeks with a tummy tuck breast augmentation, you're usually thinking 2 to 3 week increments, and you did 12 sessions with the compression therapy, which we did 10 minutes with every single session. So in the final phase now, we want to connect the legs and the upper body, because if we're still feeling fluid in the legs, we want to treat that as well, which is something you had mentioned you had dealt with prior to surgery. So now we're working on full circle wellness.
Absolutely. Yeah. We've moved beyond just the incisions, the surgery to treat the whole body.
How do your scars look and feel? Because that was like super exciting. The scar therapy is I think that's a big deal. So like you're going to have a lot of incisions. You can't avoid scars You know, you're going to have scars here in the lower area. That I think I would say sets us apart in a lot of ways is that whole scar section. I've actually dedicated a whole area to scar tissue work now in that second phase. It gets introduced in the second phase, but then towards the second and third phase, which is the final phase, we're really in the scar tissue. I would speak a little on scar tissue. I think that's a big deal in recovery.
Yeah, they look really good because of the work that we've done. I think the tool, and without knowing the
vacuum therapy. So like, okay, so in the beginning of scar therapy, you still have like, say your bandage on, but it's sealed, but you still have the tape on.
Yep.
So now we're working the scar from the outside, but we're not going anywhere near the incision.
Right.
When the tape completely comes off, we're always checking the scar every time with gloves and all the things. So like each time you come in, we're checking how are your scars, how are your incisions, we're good to go. Now we're massage therapists, so we're never going to be treating like an infection, refer back to your doctor. I will have to say in many cases, if someone's on the verge of an infection and we do lymphatic massage in the right way, it totally starts to clear up.
Oh, really?
I have worked with clients who have had full infections where the wound is completely open. I actually worked with one of Dr. Eric's clients, and it can happen to anybody. It's not a cause of the doctor when you get an infection or anything. It's just the body sometimes heals that way.
Yeah.
So I just kind of want to emphasize that, that the phases of recovery, swelling is good. It's fine. Bumpy, it happens. Like you're going to get bumpy. You're going to get swollen. Like you're going to have all these things happen in the first phase, and it's not bad. I tell clients, okay if you're puffy. Yeah. Like it's not like about squeezing the fluid out and making you not puffy. It's about gently helping the lymph to start to move. It's kind of sluggish, and then we stimulate it, and then it needs to be re-stimulated. And then eventually, like you feel now, we're not having any puffy, swelling, fibrosis. I'm like, oh, no fibrosis. We're like clear, probably even smoother than you were before, which is kind of unbelievable because as I'm speaking, if you understand liposuction, those are, I would say, key words. Bumpy, lumpy, fibrotic tissue. What did that feel like when you came in versus now?
Wildly different.
Yeah.
Yeah, there were.
You're like, I look great, but spots like this area, right? They're like under here and then along the sides here.
Yeah, I bruise easily just in life. So the bruises that I had post-surgery were definitely not a surprise, but they lingered longer than I thought that they would. And, they changed like all bruises do, but there were definitely bumps. And
that was the coloring we worked on. We took some photos, and we'll share some of these pictures, which again, I just want to thank Megan for sharing because I think women need to see how good they can look with the correct lymphatic treatments.
Yes.
Your discoloration's like completely gone. We had like a gray color under here. We used arnica. I have a very specific brand I love that's been around forever. I used it when I was a child. The right arnica cream, not just any arnica cream. So it goes deeper. And then we started with the arnica, the drainage, and the discoloration in there.
Yep. Yeah. And you didn't really give me an excessive amount of things that I had to do.
Yeah.
Homework, I'll call it. You gave me and I almost thought, am I doing enough at home? But the castor oil and using that almost nightly before I would go to bed, rubbing that, kind of especially on my abdominal area, all of the things that you were doing and the very few things that I had to do at home, just committing to those, I think really helped progress the scar along. And there's certainly still some color to it, but it hasn't even been 3 months since I've had surgery. So that just takes time. But in looking at it and the lack of bumps and weird things, it's just it's going to fade eventually, and I think it's going to look minimal and not very noticeable thanks to what you've done with it.
Well, so at this point, there's a couple things. Once the scar's smooth, because now it's actually totally flat and smooth, then you go back to most surgeons will have aesthetics. Now is a good time. Hey, we've done everything with drainage. Now let's maybe work with some laser therapy, but then it'll work really quickly.
Yeah.
It's really rare that as much as aesthetics is great, I just have to say good old grunt and getting in there with the scar tissue correctly and getting it spread and moved. And then using the aesthetics is a big bridge.
Sure.
That I really hope to see more and more. And this is what this video is about. Also, it's just hopefully we'll have some spots to really educate plastic surgeons on the work that we do with that how it integrates, so that the client can then get referred back for like the other services. Because at that point also, to the same that lymphatic massage is critical and can't replace like an aesthetic tool, there's times when an aesthetic tool, when used correctly, like laser, etc., will give you the change you need that my hands just can't do, you know. But it is applied at the right time in the right phase. That's what surgery is all about. There's one more thing: compression therapy, compression garments. We went through that phase. I have learned over time with working with fahas. I must have bought 100 fahas. I literally wore them on myself. I'm like, there's got to be a better faja. I tried on all the fahas, and the traditional faja that most all surgeons use, I love, and there's other brands, is Mirena. And after trying every faja in the world, I still love Mirena. They have a foam pad. I like to keep things simple. Keep it stupid simple, because you're overwhelmed enough. And there was something we did that was like $15 that changed everything. Do you remember what that was? The foam pad.
The foam.
Instead of buying another $300 garment, I'm like, just take this home and start putting it around, and then we'll see where you're at. And I don't even think you ended up buying another garment, right?
No. The foam really helped. I thought, how could this really do much? But I'll do it because that's what you said to do. Like, who am I to say no? Just do what is recommended, and it definitely helped. And you talked to me about, moving, like, I was putting things on, one on the front, one on the back. No, put them all the way around and put them on the sides, and just little simple.
Explore your body. And get to know your garment and get to feel what things feel like. So that, I would say, is huge for what we do. Is we want to educate you on how to feel your own fibrosis, your own swelling, your own garment, so that you will know how to adjust things, what to do and what not to do. There are things not to do. But the garment's a big one. And now, like, you're in a new phase, it might be good we don't need the clamp garments anymore, because you're fully reduced. You're not changing in size. In other words, you're not getting bigger and smaller and bigger and smaller. In the beginning, you get a little larger, you get a little smaller, and then you stabilize. And then towards the end, you're fully stabilized. In other words, you're not getting any more fluid. All those things are happening. Now, if a client wants to, a stage 2 garment's great, that has no zippers. It's just a one piece that can help to continue to give you the compression you need, but now it's giving you a little bit more shape. I use garments for natural sculpting for different things, and I use them myself when I work during the day, because I found they're just actually pretty amazing for so many other off-the-shelf things than surgery. But that's a garment, the stage 2, because really recovery is 2 years in your body. We have 2 years to do treatment, which I'll just speak, if you haven't had therapy for like a year post-surgery, you can still come in anytime. But the garment was a big one that we did. So the stage 2, we haven't gotten there to do. If you want to, I can show you some of that. We also talked about leggings, leg compressions, which I think every woman should have 3 or 4 different styles of garments. Again, I've kept it simple. I have 2 styles I use. One's very movable and textured, and the one is more tight and legging upwise. If you just use that 1, 2, 3 days a week sometimes. You're standing a lot, sitting a lot, which we talked about. What is your work-home life? Are you sitting a lot? What are you doing at home that we can help you with your drainage?
A lot of sitting. More sitting than I've realized. I thought, I move a lot. I move throughout the day, and I do, but it's not real movement that's enough to get my body, waking up, if you will. So I do need to get those leggings, just with the swelling that I've had on my legs in the past. I think it's a good ongoing option.
It's a good prevention for so the leggings help with the future of venous health, like vein health in the legs. I mean, the legs are lower, and so if you previously had bilateral, we talked about bilateral fluid generally, there's so much you can do, whether you call it lipodema, whatever it is. I don't diagnose any of that. I refer clients back to their doctor. So if they really want to get diagnosed, the doctor will diagnose it. But generally, if we see a bilateral swelling that's going to end at the ankle and start up here and be tender to the touch and bumpy, then it's sort of a light lipedema, which can be in stage 0. So you don't notice it because you're young, you're moving around. But then we get older, we're sitting for a lot longer. Now we're like, it's getting worse. It's not going down. The leggings and everything we're learning in the lymphatic flow yoga class will keep it to not ever go to the 1 or 2. You know, I can't say not ever because things happen to our body. We're going to get older, but we can definitely stave that off tremendously.
Yeah. I need to get those because everything you just said.
Yes.
What I've experienced, as you know.
So it's like the post-recovery care. You know, your care doesn't end when you're done with your healing, right? Because now we can just work on lymphatic health, which it's like, what do we do now? We're done with 12 treatments. We've been coming 2-3 times a week, here for about an hour and a half or so between the red light therapy, the balancer, which is the compression machine. Why don't we talk about the compression for just a moment? Dr. Eric also has the compression therapy. The very advanced, it's specifically the balancer part. It's not any compression, really critical because it's got the lymphatic drainage in it. I think because you followed exactly as I said, 10 minutes every time, I truly think that's why you recovered just so well. Because what will happen, I don't know if I want to do that part, and then people will kind of piece in. But like you said, we've done this for a really long time. In my experience, I have found when we do this thing, we get really consistent results. So the compression, even though it wasn't a lot, how do you feel that changed things for you?
I love it. It felt really good physically when it just, having it after the session, you already feel so good to begin with. And that is just kind of like the cherry on top. It seals the deal. And it does. It does. And it didn't ever need to be for the 30 or 40 minute sessions, just doing the 10-minute and staying consistent with it. It feels really good. And it, like I said, it's just the cherry on top to the whole appointment. And it, I'd like to have one of those at home. I would do that every day.
You can get them for home. They're just a little expensive, but you know, you can do, and we did the biocharger, which is over here. I'll say a little bit about the compression therapy and why we do it at the end. So when we're in the treatment session, we're really doing specialized work. I mean, we only have an hour, right? So it's like we want to thoroughly treat, say, the scar in the lower abdomen for this session. I can't get to doing a whole leg water treatment, which is really what we would want to do in addition to the scar. However, then going in the balancer, we're going to do the compression. That just did the full lymphatic drainage because it goes up to here. And then we have the arms. So now you got your water treatment. Yes, it's not like the hands-on water because nothing replaces manual therapy. However, the maps of the body and the actual compressive, the way the balancer goes around the entire limb, and it uses a peristaltic movement, and then it has an active phase that's active, so it's squeezing in. Passive is when it's coming out and now the lymph is refilling with fluid. And so we're essentially, it's like a toothpaste and it's getting the entire piece without missing anything. So I tell my clients, you know, this actually is going to be more effective than me working on your legs right now because in 10 minutes, it can really like clear out the straw. But we've done the hard work of clearing the scar. So if you just went on the balancer and we don't do scar treatment, you actually will probably get more fluid and more problems. I've seen that with the balancer, which I've had it now for over a year, so I understand it. We need to do the groundwork. The balancer is an assistant to our work. And then if we're not doing the balancer, I don't see the volume in the tissue go down. And I don't see the definition in the way that the balancer provides. So it's just working in these layers. So that was, usually we do massage and then compression. However, sometimes I'll do compression first. You met us kind of in a later phase, but if a client is just too tender to even be touched, we'll start in the balancer first and then move over to massage. So it just depends. Again, your provider will know what to do. The biocharger, which is this wonderful lost in space item I absolutely adore. You sit here clothed. I try to tell clients to come early and do it before their session. It's got 1,200 recipes, lymphatic drainage, post-surgery. What is it doing? You know, it's using light frequency and sound to work in the cellular level of the lymphatic system. It's interesting because I will do a lymphatic recipe and, you know, lymph is working because you really have to go to the bathroom because waste comes out that way. How have you experienced the biocharger coming in? Because you have utilized that.
Yep, I have. I think there's been a couple sessions where I was just not able to get here early, and I think I get more benefit when I can really commit to getting here early, doing the biocharger, seeing you, and then going to the balancer at the end. It's subtle. I don't feel like I'm having to actively like do anything. I can just sit here and enjoy some nice tea and still get the benefit of the light. And it's just kind of working in the background for me. Like I said, not super active, but it's part of like sets the tone for me mentally of, okay, I'm here and I just need to enjoy and like take it all in.
Yeah, because relaxation is a huge part of lymphatic drainage. I mean, because when we're relaxed and we're in that rest digest, the body physiologically expands, which is what we want to flow. Is a better word. The nervous system releases. The organs, the digestive organs, the liver, the kidney goes, okay, I can go to work now. I can open up and move some fluid. When we're in sympathetic, which is fight, flight, working stage, that's the state where the body's going to withdraw more because we're not going to detox. The body's not going to let go and detox when we're working, right? Because we're in a state of movement, right? And so that does allow for the body to start and the mind. Have you noticed you've had more energy using the biocharger? Because that's something, that'd be my number one thing is I just have so much more energy. Yeah.
There's, I do. It's funny. There's a coffee place, actually went there this morning, but a coffee place down the road from here that I like to go to. And I don't know, mentally, I just don't necessarily want to come caffeinated and ready, like a little too amped up before I see you. So I'll say, I'll wait till afterwards. And I don't ever go afterwards. I don't feel that I need it. I don't need the caffeine. I'm like, I feel great. I don't want to have it because I'm already there just naturally.
I love that you said that. Yeah. And the lymphatic tea that you drink that we custom make here, the bath salts, all the things, the oils, the tea also has digestive herbs and all that we've had. How do you like the tea?
I love it.
Here?
Yeah, I love it. Yeah, you sent me home.
It's a lot.
And I've had it at home. I don't think it's as good as you.
It's a little different. There's kind of there's a trick to it. And honestly, I don't even drink it as much at home because it just tastes different here. Yeah. It's got to be the energy. And honestly, like it's being biocharged. All of this is being charged all day long. But the lymphatic tea also warms up your body. So the tea is warming up your blood. I mean, lymph is all about the movement of blood and exchange in between the interstitial tissues. This is our body all day long. Our body is expanding and contracting. And that's why at night you'll put on, sometimes you'll put clothes on, they're tight, other times they're loose. Yep. Our body is always doing these things. And when I say interstitial spaces, I mean, like, you have your skin, then you have like the vessels, then you have like the bones. It's the fluid in between the bones, the skin, the muscle. That's interstitial spaces. And that's what we're dealing with the lymphatic system. So I just the idea of lymphatic drainage is good, but we're not actually like draining the body like where you're squeezing fluid out. Yep. For me, it's about getting the movement of the vessels to do this peristaltic movement, which is actually the same as the heart or like the peristaltic in the colon where it moves like a little caterpillar. So this idea that we're like squeezing things out, to me, a better description is we're stimulating angiomotoricity. We're stimulating the cars to move. We're getting rid of the congestion. So other things can come and filter, and essentially all that goes to the heart, filters through, and it recycles fresh, clean blood through the body. So we're actually a filtering system as a lymphatic system versus I got to drain everything out and get rid of it. Yeah. We do by going to the bathroom and peeing and digestion. So colon, digestive stuff usually gets better after the first session. I don't know if you experienced that, but dealing with the gut, dealing with the rib cage, and dealing with this section of the body, we worked a lot on, is my rib cage moving? I think it was one of our first sessions. Well, if the ribs aren't like doing this and the digestion, then no matter how much I squeeze and drain, you're just going to fill up by the end of the night because I haven't moved the muscles that are creating that movement in the body and the angiomotoricity of the muscles. Was there any shift for you in digestion?
Yeah, just a few weeks prior in between seeing you and surgery was not not a great time for me.
Yeah, and that's the case for everybody. So that's a good subject to mention. Yes, because that's a frustration for a lot of people. Is something wrong with me? No, you're in fight flight. You just had surgery for 8 hours. Your body's like, what are we doing here? Do we release? I don't know. That's what's happening.
Right. Yeah. So it definitely helped. It was much needed, and things just continued to get better, and that's kind of the new normal for me now.
And that's usually like within the first session, I would say my first goal is not so much, I want to get all the fluid down. It's I want to have you getting to the bathroom in a healthy way again. And I want you to feel like you can take a breath.
Yeah.
Because if you're going to the bathroom and you can take a breath and you can create this movement, now your body's actually draining. It's its own plunger. Like if you think of the diaphragm, right? It's like this. It's 360 degrees, right? So I think of like all the way through. It's going like this. You've had surgery. What's going on, right? Nothing's happening. And then we're letting go. And then we get the plunger, it pushes all the way down. Well, what happens? All that stuff that's been stuck, it comes all the way up and then we're released. So I don't know if that's like a good description.
Yeah.
So the philosophy is kind of different around here. I'll talk just a moment on the water technique, the berry method technique. We use Eastern, Western mythologies, and then I use techniques that I've just created through understanding the body for 25 years and just obsessing over constantly pivoting. It's not about doing the same thing you learned in class. It's about pivoting and finding new ways. Then there's traditional techniques like water that are critical, which is the light skin stretching, active, passive. When I went back and restudied water, I was like, oh my God, this fills a gap. This is skin stretching. This is not glide. It's all dry. Everything's dry, no oil. You can't get that stretch if you have oil. But then we go into the oil techniques with all the more Ayurvedic stuff and all those things. We're like doused in oil, right?
Yeah.
You're like, wow, I'm oil bath.
Yeah.
Because now we want to do more of a different style of deep treatment, but we don't want to start with deep organ treatment unless we've done water and moved things. So it's really like, we call it the lasagna. You're working all these different pieces.
Yep.
So you just get this really nice, essentially you want movement between the tissues like this. So for surgery, if you think of it, first time you're like, everything's just like this. Now we're moving, everything's stuck. The noodles are kind of the scar tissue. And then we start to get movement and we want scar tissue to glide. Just like note on scar tissue is not bad. Scar tissue is tightly knitted tissue that is protecting you and keeping you healthy. But when the scar tissue doesn't, this is the whole process of massage, it doesn't know how to create glide for itself. So as a massage therapist, that's why like a laser and all that stuff might help. Right. But we're not creating movement yet. Once you can get the movement, now go for it, do all the lasers. That's awesome. But we want to start with the manual stuff. So I don't know if that, you're learning a lot today. If that kind of explains why manual, good on getting your thumb in there and working. We start with our hands first. On the note of tools, because we do use a lot of tools. We're only using tools when it's really needed. I think primarily we want to use our hands and manual massage techniques. But like my hands don't have the scraper texture that I need to get into the gritty tissue. So you'll go like this and your hands are fine, and then you take the scraper. You're like, okay, now where you can actually feel.
Those are different,
You're like, the scraper.
Yeah.
Which is intense, but we always work with your comfort level and work from there. I don't believe in pushing through pain and holding your breath.
Right.
So, how the scraper techniques change things for your experience?
I think that was kind of, I don't remember exactly, but it was a couple sessions in. You definitely didn't start there, and we're not using it, anymore. But because I was a few sessions in and had seen progress already, you introduced it in a way, like you just said, we're not going to make this painful, so you need to let me know if it is, and we'll adapt accordingly. And I thought, okay, I don't want to be in pain either, but I'm here to do the work and let you go further. Than this isn't just a comfortable, like, we're here to relax. We're here to do a little bit of work to progress. And it wasn't painful at all, but it helped kind of turn things around. Like physically, I could see differences after that session more than the others. because we were a few sessions in by that point.
Yeah, and I think probably the last thing I kind of want to mention is that people will call and say, I'm really scared that this is going to be very painful, because there are different techniques that are now being found. And I'm just going to stay very broad with this because I always want to be careful not to hurt someone's feelings or say something that will deter someone from one place or another. But and I'm going to say this as my own provider and what we've learned from going deep in the beginning and then further as we go. What we're starting to find, especially with plastic surgery, is it's just there's so much lymphatic massage now. How do you set the standard and the pace? And where do you go? And with prices from what we charge from like 300, 200 to 150 or 25, what's the difference between all the different pieces? You should never be in pain to the point where you are holding your body. That's why I created the program, because every provider that we train and teach, they know when they see that service, they know exactly what they need to do. So they have their own creative space to work with that treatment. But we know in the first phase, there's no need to cause pain.
Right.
We're in water, we're in spatula techniques where we're just literally moving. You can actually feel the fluid like a river under your hand. We are not going to dig on that tissue. Like, no, we're not doing that. We want to just move the fluid. We want the tissue to heal itself. Once it's healed, then we can go deeper. When we're in scar work, now we're quite a bit deeper.
Yeah.
But we are not starting there.
Right.
Even if you're 4 weeks out, even if you've been fully healed, in some cases, I'll start deep because the scar is so deep, the lymph just won't move unless I start with the heavy work. But that's a different scenario, which is why, again, it's your provider. She's going to decide. But that is something people think that lymphatic massage should be painful, and it shouldn't be. And especially in the beginning phases, it should be comfortable.
Yeah.
But there's a balance where you're at the therapeutic edge where we have to go a little deeper, but not so deep that you're uncomfortable. Does that make sense?
Yeah. I would say that's exactly what I experienced. There was never any pain. There was times where it was a little more work. My husband would give me a bad time, like, "Oh, you're going to get another massage." I'm like, it's not a massage that you're thinking like that you see in the movie.
Yeah.
We're doing work, but it's good work, and you see the change.
We use hot stones for nice warm work, but we also use it to do scraping. Because sometimes a stone introduction is a nice way to work on fibrotic tissue and then do some brachytherapy. And there's different cups we use for different things at different stages, which again, it's not just vacuum therapy. It's not just cupping. There's a very specific way that I do brachytherapy. And again, we only use tools where it needed for a limited amount of time once we've dealt with the actual groundwork of the body.
Sure.
One more thing with the providers you've worked with here, because in massage world, I think there's still this status of like, I find my therapist and that's who I see, and I do understand that. What I'm trying to break the mold in is to become more of a medical care facility where you come and see your care team and you trust that everybody is working together and everyone is trained together and everyone understands that we're on the same page. Our techniques and modalities, we know the foundation, but everyone has a very different feel, touch, and eye. And if they're here for a reason because they contribute to the team and to the overall journey. So I tell my clients, you're going to disservice yourself if you only just see me and you don't see the other providers, because they're all going to have something so powerful to give to you. And by the time they're done going through everybody, then they understand the process. I was just going to touch on that just for a moment, because of that like statistic in the massage industry that I found challenging to explain. But if we hear it from, somebody who's received the work, I think you can understand it more.
Yeah, sure. I most of my sessions have been with you, but I saw Eva, is that pronounced right? Yeah. And I thought that would be kind of interesting just to go to someone else as an option, because she's been trained by you. She obviously has all of the access to the tools that you have, but maybe she'll see things slightly differently. It's like when you, just anything. If I were to style my hair, but I go get my hair cut, my hairstylist does it, it looks a little bit different, right? So she sees things differently than I do. I thought that would be an similar concept where, you've been working on my body and the path that you want to take it on, and she sees things the same but different.
Yes.
I felt like I still got just as much treatment, and obviously she's wonderful. It has, good care, and I didn't feel like it was less than by any means. So I would say it's important to be able to see multiple people.
Mm-hmm.
It's more about what's happening with your body, less than like who is actually doing it every time. It doesn't need to be you necessarily, because she was wonderful.
Absolutely. And I mean, it allows us to, thank you for saying that. It was great. And we've trained so many providers over the year, and it is so exciting to see them come from where they are and where they get to. And then, I think when I choose a provider, I choose, well, one, the touch, two, the compassion and love. Like when you're healing with people, like you can know everything, but if you show up as a provider and you don't hold the energy where you feel comfortable, because you're vulnerable during any time, whether it's a wellness autoimmune client or auto accident or plastic surgery, especially with plastic surgery, just because you're in a very vulnerable place, and it's just critical. Bedside manner is so important, that you feel the compassion, the care, the love, just with the hands, with the way that somebody talks to you. They care about how are you doing. And also that your treatment plan has a window. It is so important to get a lot of treatment in the beginning. Yeah. So I tell clients, I don't like to spread things out. We used to do like 3 sessions a week, but we find it's not necessary anymore with the compression therapy and all the other modalities. I like to actually just do 2 sessions spaced apart and have you heal longer. Yeah. And then you get from 2 weeks to 2 times a week to once a week to once every 2 weeks to then once a month to then, you pick your choice type thing. Yep. But in that first phase, so like from day after, so actually pre-op. So ideally I like to meet clients as soon as they know they have their surgery date to get in for a pre-op assessment, lymphatic assessment. We had a client from Dr. Algan that sent us a pre-op client, which sometimes they can get in soon enough. And we actually found that there was some lipodema and some decongestive stuff we needed to do. She healed amazing. I've had that same demographic of a client come in, didn't do any pre-op, and the post-surgery just was a lot of work to get that post-surgery care done. And so the pre-op appointment will actually reduce the amount of drainage you need after, and you'll start to heal really fast right away. So that first window, ideally it's pre-op like a week before or even 2 weeks, just because this work is really powerful. I'm not sure how clients will respond, and sometimes they want them to come in for one more session. So we don't treat like a day before surgery ever, because we don't know how they're going to recover from like the lymphatic treatment. Because usually if you're going in for surgery, it's because there is some kind of lymphatic congestion. I don't like how this is, Randall. You've lost 100 pounds and now you need a full body lift. So you have a lot of loose skin that you're dealing with. Post-surgery, if you haven't come for a pre-op appointment, that's fine. Within 5 days. I used to do the next day or 2 days after, but if it's a full body lift and stuff, I don't think it's worth moving the incisions. I want those incisions to sit still. I would love to be able to just drive to a client's house. Hopefully, honestly, one day we'll have that service where your first session is at home. I'd love that. Yeah. But we want to take care of those incisions. I've learned that the incisions are more important than the fluid, because I can catch up on the fluid. I don't want you moving around a lot. And so usually like 3 or 4 days after, they can walk around. They can even walk, and it's good for them to walk. And then we start that post-operative process. And then, ideally, the minute you know you're coming in, we do want to try to schedule you actually as soon as you're on the phone, because schedules book up. And that's why we have that team. So we can immediately get you in twice a week. And if you're only want to see one provider, I'm about a month out right now. That's way too long. Your recovery's happened. All the things have stitched together and not the way I want them to. So this is when post-surgery, now your body's fighting like crazy to stitch everything back together, because you've been totally taken apart. That's why I'm like, you need to get in like right away and stay consistent with at least, at bare minimum, once a week to 2 times a week. So, and with the compression therapy, clients don't want to do that. I say you can do that, but again, the compression's dealing with that volume, which if you think of it, if you have that volume, if we're stitching things together, we're getting rid of the unnecessary fluids so things can come back together and knit faster in a good way. because it's all about how it comes together. Now, there is a technique called Rejuvenation that is very popular. And Dr. Agram does it. A couple other doctors do it. Rejuvenation speeds up the healing super, super fast. So if someone has Rejuvenation, I'll have them, that client sometimes, I will have them come in maybe 4 days in a row or 3 days in a row to kind of get, because it's speed heals. So you're stitching together faster. So now we need to do more massage. So I thought I would just clarify that healing process in the first week, because that's a huge question for clients.
Yeah.
Yeah. Yeah. Yeah, it's interesting. So I think, thank you, Megan. Is there anything else? You're just like rock star that interview. Hopefully you guys learned a lot. Hopefully you learned a little bit.
I've learned a lot just coming here. And I would say to anyone who's considering, like, do it, do the surgery and come to cohesive therapy, because you guys are amazing. Everything has been fantastic, and it has changed my body for the better. I think it's changed my relationship with my body, and I'm more aware of what's happening and what isn't happening, and it's been fantastic. So thank you.
You're welcome.